Senator Perdue.
Thank you, Mr. Chairman. You know, Ms. Fitzenmeyer, I agree with you. But I'm on the other side of that generational gap. I don't want to be the member of the first generation that has to tell your generation that my generation is leaving your generation an America that's worse off. And yet that's what all the numbers say today, in my opinion. The problem is a lot worse than you said, though. And if you Dr. Kolkoff, I agree with you. We can make the number, pick a time period and get a number. It's 150, 200 million. Pick a number, but you get it back to households. The responsibility to pay this back over time is about $2 million per household. It's not 60,000. It's about $2 million a household. We all have car payments. We all have mortgages. That's unmanageable. And Dr. Kolkoff, I have a question I want to get to, but I honestly think this is the biggest crisis we face. It threatens our national security. It threatens the ability to talk about this gap, the gap we could talk about. And Mr. Chairman, I'm sorry. Conversation in this committee that I've watched the last 3 times, that conversation does not serve the American people. This partisanship that's in here, this should be like a foreign relations, should be like armed services, should be like intelligence committee, where we're talking in a bipartisan way to try to get at the solution of this thing. How we got here, there are no innocent parties up here. I've said this for 2 years. I've not been in politics. I'm an outsider looking at this thing, and I can tell you what, people out there hear what we say in here, and it doesn't make any sense to them, and it doesn't make any sense to me. I could argue all day long that the crisis in 2009 started in '98 when we changed the home ownership rules about mortgage qualifications. But I want to get to a question today that relates to what do we do to get out of this. I think we all realize that the problem that we have is today we're facing a problem. By April 15th, we have to put a budget together. OMB, the President wants $4 trillion. Right now in that budget, there's something like $229 billion in interest payments. There are another $95 billion in accrued interest that goes to Social Security in terms of the other $4 trillion of debt. So we have $18 trillion that we talk about today. In just simple math, if interest rates were at their 30-year historical average is somewhere around 6%, we'd already be having a request in here on that budget for $1 trillion of interest. Personally, I can debate all day long about whether it's $200 trillion or not, but the one thing that we can't argue is that next year we're going to have to make X number of dollars of interest payments, and if interest rates get back to a 30-year average of 6%, I just don't see, frankly, how we can pay that. And the question I have, Dr. Kolkoff, is have we already passed this tipping point years ago? This is not a partisan question. It's a question of what do we do now to get out of here? And I want to follow up a question behind that.
Well, we're in very deep water. I have proposed. You asked what we can do. I've proposed at www.thepurpleplans.org reforms of the tax system, reform of the Social Security system, reform of the health care system, reform of the banking system, reform of the energy treatment, energy policy, which many economists, including many Nobel laureates, have endorsed these bills, these proposals. Each one of them is a postcard in length. So I would encourage you to take a look at www.thepurpleplans.org. It's purple because it's a combination of red and blue. It's supposed to interest both parties. Those proposals could dramatically reduce, if not eliminate, the fiscal gap. And they really, I think, meet the concerns of the Republicans and the Democrats. And these are what economists would say will get us out of this hole and help our kids, and also produce more equality, I believe, for within a generation, more equity, more progressivity, because we have such a complicated fiscal system. We have something like 25 major fiscal programs, from the earned income tax to the alternative minimum tax, that getting a picture of the overall progressivity of the system is quite difficult. But I think that on balance, these things would improve progressivity.
I'm sorry,
Mike? Oh, yeah, there we go.
Should be on, right?
Yep.
Sorry. You mentioned to solve this problem, you can increase taxes 58%. You could cut spending 37%, the number directs 38%. But we didn't talk about growing the economy. And the numbers we're being given by OMB, if we grow the economy 1 GDP point, 100 basis points in GDP, that's $4 trillion over 10 years.
Right.
The question I have is, you know, this gridlock that we've watched in Washington for the last 15 years, under several administrations, 11 different Congresses. We're not getting anywhere. That gridlock is not going to work. I just don't see how we're going to solve this without growing the economy. We talk about the earning gap, and I agree there's an earning gap, but we can talk about how 30% of people who are not working today are contributing to that. I mean, we have created an environment out there where we just don't have the economy working. In the last 6 years alone, 4 million women have fallen into poverty, and the middle class is getting whipsawed by the economic policies right now. Obamacare alone has got 2/3 of small businesses have either stopped hiring or have cut back employment. So, the question is can we get to debate about how to get the economy going into this conversation about dealing with this budget issue?
Okay, so one of the problems, Senator, is that we have less investment going on. And if you look at this chart of the national saving rate and the domestic investment rates, you see that all this financing of a higher consumption through these pay-as-you-go Ponzi scheme policies we've been running, some of which are very important, but Medicare Part D is an example. President Bush imposed a $15 trillion addition to the fiscal gap in that measure. Now, do we need health insurance for drugs for the elderly? Absolutely. But should all the elderly have been left off the hook in paying for it? Absolutely not, especially the rich elderly. So we do need to have government involvement in a lot of areas, including social insurance. The Purple plans say this, but they also say you need to make sure we don't kill off our kids and making them pay for all our bills. And so one way to get things turned around is to get investment up, and that means to get saving up, and that means to get consumption down, actually, as a share of national income. And absolutely getting the burden off of our small businesses. So what about rationalizing our healthcare system? We now have Medicare, Medicaid, Obamacare, employer-based healthcare. The government's involved in all 4 of these programs. We've got 4 different programs trying to provide basic health insurance to everybody. The Purple Health Plan provides a voucher plan, individually risk-adjusted, so it's actually highly progressive, that would provide a basic insurance plan for everybody in the country. I've talked to Congressman Ryan and people on the left as well. I think that's the way to go, and most economists do. This would eliminate all that paperwork that you're concerned about that employers are now facing.